The Critical Care Pain Observation Tool is a behavioral pain assessment that can be used to detect moderate to severe pain in adult patients who are unable to communicate. The CPOT assessment can be done at rest or during a painful procedure. It focuses on 4 behavioral indicators of pain: facial expression, body movement, ventilation or vocalization, and muscle tension. Each indicator is scored between 0 and 2. The sum of these scores is the CPOT score. A CPOT score between 0 and 2 detects the presence of no pain or mild pain. A CPOT score between 3 and 8 detects the presence of moderate or severe pain. A CPOT score of 3 or more indicates the need for a pain management intervention. Pain assessment at rest. Observe patient behavior at rest for at least 1 minute. Test muscle tension last to avoid stimulating pain-related behaviors. Begin by observing the patient's facial expression. A patient with a relaxed face receives a score of 0. A patient with a tense facial expression receives a score of 1. Full contraction of the face receives a score of 2. Observe the patient's full body, noting their movements. A relaxed or unmoving patient receives a score of 0. Patients who touch or rub pain sites receive a score of 1. Patients who move aggressively receive a score of 2. In patients who are not intubated, listen for vocalizations. A patient who is silent or speaking in a normal tone receives a score of 0.
Where did the cats go?
A patient who is sighing or moaning receives a score of 1. A patient who is crying out receives a score of 2. To assess muscle tension, perform passive flexion and extension of the elbow as appropriate, observing muscle tension and range of motion. When there is no resistance to passive motion, the patient receives a score of 0. When there is some resistance to passive motion, the patient receives a score of 1. Strong resistance to passive motion receives a score of 2. Pain assessment during a painful procedure. Perform observations during a standard care procedure known to cause pain, like turning or repositioning, endotracheal tube suctioning, or wound care. A patient with a relaxed face receives a score of 0. A patient with a tense facial expression receives a score of 1. Full contraction of the face receives a score of 2. A relaxed or unmoving patient receives a score of 0. Patients who touch or rub pain sites or seek attention through movement receive a score of 1. Patients who kick or reach forcefully for their breathing tube receive a score of 2. In patients who are intubated, observe the patient's breathing and listen for ventilator alarms. A patient who tolerates ventilation receives a score of 0. Some coughing or ventilator alarm activation receives a score of 1. A patient who is asynchronous with the ventilator receives a score of 2. To assess muscle tension, observe the patient's muscle tone. Note resistance to motion if the procedure involves movement. When there is no resistance to passive movement, the patient receives a score of 0. When there is some resistance to passive movement, the patient receives a score of 1. When there is strong resistance to passive movement, the patient receives a score of 2. Adult patients in critical care often experience pain and are simultaneously unable to communicate. The Critical Care Pain Observation Tool can detect pain and guide appropriate pain management interventions. The CPOT is recommended for routine use in adult critical care settings by the Society of Critical Care Medicine.